Hello and welcome. If you're a physician running your own practice, you're not just a doctor. You're basically the CEO of a small business. And that business is operating in a totally global world now. From the patients you see to the vendors you hire, everything is connected. And that brings some amazing opportunities, but it also opens the door to some really serious hidden risks that could threaten the health of your entire practice. So let's break down what you really need to know.
It's a question every single practice owner has to ask themselves today. It used to be that deciding where to send a patient was about finding the best specialist in town. Hiring a billing service, you just find a reliable local company. But that landscape has completely, totally changed. Your biggest vulnerabilities might actually be thousands of miles away.
So here's what we're going to cover. First, we'll talk about this new reality of a globalized practice. Then we'll look at what happens when your patients decide to go abroad for care. The whole medical tourism thing. After that, we're going to turn inward and look at your own operations, specifically the big temptation to outsource your back office. From there, we'll dig into the hidden costs, show you how to defend your practice with smart contracts, and finally, we'll talk about why going local might just be your biggest advantage.
Okay, let's start with the big picture here. For better or for worse, we are all operating in a borderless world of healthcare now. And that puts two very different kinds of global pressure on your practice. This is the new reality. It's a two-front battle, really. On one side, your patients are getting ads from clinics everywhere, from Turkey to Thailand, promising cheaper and faster care. And on the other side, you're getting pitched by companies overseas that promise to run your entire back office for pennies on the dollar. Both of these trends add a whole new layer of risk and complexity to running your practice. So, let's look at that first part, this whole phenomenon of medical tourism. It is a massive, growing industry, and believe me, it has a direct impact on the care that you're trying to provide.
The gap between the sales pitch and the reality here is just, wow. The pitch is so attractive, right? Huge cost savings, no waiting lists, world-class care, all in one neat little package. But the reality can be an absolute nightmare. We're talking about cases where unlicensed staff are doing procedures, where there is zero legal recourse if something goes wrong, and where patients are exposed to counterfeit drugs. And guess what? When that patient comes back home to your practice with a whole host of complications, you're the one who has to clean up the mess.
Now that pressure from patients going abroad is only half the equation. There's an equally powerful pressure coming from inside the business. With costs always on the rise, a lot of physician owners are desperately looking for ways to be more efficient. And that search often leads them straight to the idea of outsourcing things like billing and coding.
So here's the formal definition. It sounds so simple and logical, doesn't it? Just find cheaper labor in another country to handle all those administrative tasks. The main driver, almost every single time, is that promise of saving a ton of money. But, as we're about to see, that promise, it often doesn't pan out.
So, what is the real price of going offshore? Well, there was a major 2-year study that gives us a pretty clear, data-driven answer, and it's not what the offshore vendors want you to hear.
This quote really just gets right to the heart of it. It comes directly from the research on practices that made this switch. They went in thinking they were going to save a bundle, but the operational failures and all the hidden errors actually ended up costing them way more. The big question is, why does this happen?
Let's put a hard number on it. This Kiwi Tech study found that because of certain coding errors that are really common with offshore teams, payment levels drop by an average of $4,500 per inpatient encounter. Just let that sink in. Any savings you thought you were getting on labor costs are instantly gone, and then some, just from reimbursement losses.
And the study pointed to 6 key patterns that cause these losses. You've got lower productivity, so you end up needing more people just to do the same amount of work. Then there's reduced accuracy and higher denial rates, which means your own team is spending all their time fixing mistakes and your cash flow just grinds to a halt. The fewer inquiries on complex cases, that directly cuts into your revenue. And finally, slow onboarding and turnaround times create huge bottlenecks, which leads to more discharged, not final billed cases, which is just a fancy way of saying you're not getting paid. It's really like death by 1,000 paper cuts for your practice's finances.
And look, the financial part is only half the problem. The liability you take on is just staggering. Under HIPAA, you, not them, you are ultimately on the hook for any data breaches by your offshore vendor. We're talking fines up to $10,000 per violation. There are documented cases of data theft. And if you have a legal dispute, good luck. The legal backlog in a country like India is estimated at 350 years. That means you have basically no real legal recourse. None.
All right, I know this all sounds pretty bleak, but it's not hopeless. There are absolutely concrete, real steps you can take to protect your practice, whether you're thinking about a new vendor or you're already stuck with one. Your single greatest weapon, your best line of defense, is that service agreement. Before you sign a single thing, you have got to treat that document with the exact same level of scrutiny you would a really complex medical chart.
Think of this checklist as your shield. Does the contract make the vendor responsible for their own mistakes? Is there a rock-solid business associate agreement in place that forces them to carry cyber insurance? Here's a huge one. Can they send your data overseas or to a subcontractor without your written permission? Because a lot of US-based companies do that quietly. And maybe most important, can you get out of the contract if they're doing a bad job, and will they give you your data back without holding it hostage? If the answer to any of these is no, you either have to renegotiate or just walk away.
So this brings us to the final and I think most crucial point. Instead of chasing these phantom savings all over the world, the most strategic thing you can do might be to recognize the incredible value that's right here at home. When you just lay it all out like this, the choice becomes pretty clear, right? On one side, you have the offshore model, which is just full of high turnover, communication delays, and massive liability. On the other side, a US-based partner gives you a team that actually understands our ridiculously complex healthcare system, which means fewer errors, you get better service, and here's the kicker, a lower total operating cost when you factor in the cost of all those mistakes. Plus, your data is secure and you have actual legal accountability.
So, we'll end with this thought. As a physician, your entire life is dedicated to protecting your patient's health with incredible diligence and expertise. The question is, are you applying that same level of diligence to protecting the financial and legal health of the very practice you've worked so hard to build?